Welcome to this community briefing on our ongoing pandemic response effort. And providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. With the local COVID cases increasing dramatically, our local situation continues to change rapidly, and our risk dial will remain in red, indicating the risk of the virus transmission and the impact on our community is severe. We hit our highest weekly case total last week, which was 2,893 cases. We continue to see new cases of the Delta variant and are also now on the front end of the Omicron surge. We're urging all members of our community to take action to help themselves and their loved ones slow the spread of infections. Let's run down what we need to do and why we as the community need to act now. For at least the next 3 to 4 weeks, go out only to go to work or school, to buy food or get medical care, or to get tested or vaccinated. Get vaccinated or boosted now. Mask up indoors and around other people from outside your household. Avoid crowds and don't attend big events such as concerts and athletics. If you choose to take the risk, wear a mask and remain away from those who might be more vulnerable. Get tested if you have COVID-19 symptoms, which can be similar to cold or flu symptoms. Get tested if you've been exposed to someone who has the virus. If you are sick, stay home and away from others. Watch your distance and wash your hands. Taking these actions will help keep our schools open, access to health care available, and will limit disruptions in business and government services. With our risk dial in the red for the second week, we have updated the guidance on our website. You'll find it posted at covid19.lincoln.ne.gov. Unfortunately, what we're experiencing locally is similar to what we are seeing across our state and country. The Omicron variant is highly contagious and is spreading rapidly. Nationwide, we are averaging more than 500,000 new cases a day, far more than at any previous point in the pandemic. Last week, ending January 8th, we had nearly 2,900 new cases, as we mentioned. It's the highest weekly total since the pandemic began. This chart that you're looking at now shows new cases by week, and you can see the sharp increase at the end of 2021 and into 2022. Over a 2-week period, the number of new cases increased from 982 to 2,900 figure, an increase of 195%. Unfortunately, we are likely to see our case numbers continue to rise. If you look at our 7-day rolling average of new daily cases, it also shows this sharp increase. The average rose from 127 per day on December 26th to 410 at the end of last week. That's an increase of 223%. Most schools in Lincoln and Lancaster County are now seeing a high number of students and staff testing positive for COVID-19. We are also seeing the virus spreading in family gatherings and smaller group settings. Last week's data also shows that 50% of our cases are in people under the age of 30, and 30% are in the 19 to 29 age group. The positivity rate is also very high. Last week it rose about 20%, ending at 22.6%. The bottom line is that COVID-19 is widespread in our community. It was reported yesterday that the United States topped 132,000 COVID-19 hospitalizations, the largest number ever reported. We are very concerned that we will see this trend locally due to the large number of new cases we are experiencing. Our local COVID hospitalizations are not at record numbers, but we are continuing to see COVID-19 putting extreme pressure on our hospital systems and our health professionals. The 7-day rolling average of COVID patients hospitalized locally shows a steady increase from 112 on December 24th to 123 on January 8th. Over the weekend, we did see a more significant increase with 131 patients reported on Sunday. And today, the hospitals report 142 patients with 15 on ventilators. 96 of these patients are from Lancaster County. And also 92% of our local hospital ICU beds are currently occupied. The COVID-19 hospitalizations are devastating for patients, their families, and our healthcare providers. And unfortunately, when we have a high number of people hospitalized due to COVID-19, the result is almost always an increase in deaths. COVID-19 hospitalizations and deaths are much more likely among those who are unvaccinated. We are reporting the loss of another member of our community to COVID-19, a man in his 70s. There have been a total of 12 deaths so far in January. And unfortunately, this is our reality right now. And we expect cases will continue to climb quickly, leading to more hospitalizations and potentially more deaths. If you don't think our situation is urgent, you're wrong. If you're sick of COVID, now is not the time to become complacent. If you've been taking preventative measures, I thank you. We must be prepared that things will get worse before they get better, and our local situation requires an urgent community response. Fortunately, we can all take personal preventative measures to reduce the impact of the virus, and recent developments provide us with more tools that we can use. As we've said before, vaccinations remain our best defense, and booster doses provide a greater level of protection against the Omicron variant. Vaccine is available for everyone age 5 and up, and last week, Pfizer booster doses were approved for those aged 12 through 15. More than 700 children in that age group have now received their boosters. Vaccines continue to help prevent severe illness and save lives. They are also critical in reducing the impact of the Omicron and Delta variants on our healthcare system and the community. And here's a quick rundown of the latest vaccination percentages. 64.7% of all Lancaster County residents are fully vaccinated. 53% of our residents aged 16 and over who are eligible have now received a booster or third dose. Recently, the recommended time frame for Pfizer and Moderna boosters was changed from 6 months to 5 months, so more of our residents are now eligible. The 53% reflects that change. 26% of children ages 5 through 11 are now fully vaccinated, and just over 34% have received their first dose. So parents, if your child has not yet received vaccine, we urge you to act now to better protect them. We are leading the state in our overall vaccination rate and our booster rate. We also continue to lead the state in the percentage of those fully vaccinated among all age groups, with the exception of 18 to 24-year-olds. We continue to work with our partners to accelerate vaccination. And this week, walk-in clinics are offered every day, and 3 of those are at local elementary schools. The first one is from 4 to 6:30 tonight at Arnold Elementary School. Tomorrow, we will be at Clinton Elementary School from 3:15 to 6 p.m. And on Thursday, we'll be at Elliott Elementary School from 3:15 to 6 p.m. All 3 of these clinics will also offer first and second doses for those age 5 and older. Pfizer booster doses for those age 12 and older, and Moderna doses for those 18 and older. From start to finish, this process usually takes less than an hour. Residents may also schedule an appointment or find additional clinic times and locations at covid19.lincoln.ne.gov or by calling us at 402-441-4200. So as we've said before, prevention remains the most effective option. But with Omicron and its high level of transmission, we know more people will be getting the virus. Testing continues to play a critical role. Many people are eager to get tested, and it's important that our community has several options. We are aware of the longer waits due to the high demand for testing and concerns about availability. We hear you. Starting later this week, a new testing site will be opening in Lincoln. The health department is partnering with Total Wellness, a wellness company based in Omaha, to open a drive-through testing location at 1918 O Street in Lincoln, beginning Thursday, January 13th. The hours of operation will be from 9 a.m. to 4 p.m. Monday through Friday, and testing will be available by appointment only due to the high testing demand. People can go to tolnawellness.com/Lincoln to schedule an appointment. Other testing options in the community include the NOMI drive-through site at Gateway Mall. Tomorrow, NOMI will be adding another drive-through lane at their site, which will increase the availability of testing options. So you can check their website to schedule an appointment. We also are having testing at Bryan's Healthcare Urgent Clinics, Care Clinics, CHI Health Priority Care, and several of our local pharmacies and some of our healthcare provider offices and other urgent care clinics. You can find more information at covid19.lincoln.ne.gov. Even with the additional testing options, demand could outpace capacity for the time being. Please do not get tested just for peace of mind, and please don't go to your local emergency room only for a test. If you do test positive for COVID-19, you need to isolate. If you're exposed to someone who has COVID-19, you may need to quarantine. And new quarantine and isolation resources are posted on the covid19.lincoln.ne.gov site. And these infographics help walk you through what you need to do and when. Other tools now available in our community are recently approved antiviral medications from Merck and Pfizer. Our community has very, very limited quantities of these medications, and your local physician will help determine if either of these would be an option for you. It's important to remember that treatment does not take the place of prevention. COVID-19 vaccines are safe and effective. They help prevent severe illness and save lives. We will continue to be in this Omicron surge for weeks, and it's important to act now to protect yourself and your loved ones and to reduce the spread of the virus. This will help keep our schools open, makes access to care available, and limit disruptions in business and government services. So here's a quick recap of the tools and resources we mentioned today. Information of all of these is available at our website. Updated red guidance, updated vaccine clinics, testing options, isolation and quarantine infographics. And with that, we'll take any questions.
Okay. Hi, Pat. So there are are there any decisions on indoor mask mandates?
You know, our situation is growing more severe, as I just said, and we are continuing to work with our medical professionals in evaluating our current situation. And we are still considering all tools that are available, as I've said before.
Can you comment on recent non-COVID illnesses that are being observed in Lancaster County, such as flu or other respiratory infections?
I'm sorry, I didn't hear that.
Can you comment on recent non-COVID illnesses that are being observed in Lancaster County, such as flu and other respiratory infections?
Yeah. Well, we know that there are cases of flu-rona. We're still seeing our cases primarily in that younger age group, under 29. We have seen just recently in the last week some cases growing into the older age group, and definitely our numbers are, exponentially higher than they were last year.
Okay, then another question regarding mask mandate. Last year, when cases surged, there was a mask mandate in place, and local officials took measures such as shutting down youth sports. Why no move to do any of that right now?
I think I just answered that question when I said we are continuing to work with the medical professionals in the community, and all our options are still on the table.
Is there any concern for an increase in COVID cases as UNL students begin returning to campus this week and next?
Absolutely. As we've said before, we do have a mechanism in place. All students returning will be tested next week. We have precaution and safety measures in place. And I'd want to make a little comment on that last question about youth sports. I think what I tried to say, and just to make it crystal clear, that is not something that we are encouraging people to engage in right now. But if that decision is made to do that, if the risk is assumed, then we need people to wear a mask. And then we need them to monitor for signs and symptoms of illness, and please not be around vulnerable adults.
Another question related to UNL. Is there any advice you would have for the students returning to campus and anything that the health department will be looking for?
You know, UNL has worked with us throughout the pandemic. All students will be masked. We talk at least twice a week, sometimes even every day. We are working on some things. But I would advise them to make sure they're using their mask and to make sure that they've been vaccinated and they've received their booster. That's really one of the most critical pieces that they can do.
All right, for that new testing site, is there a certain number of appointments available a day? And what do you anticipate turnaround times look like for PCR tests?
Oh, great question. The number of tests per day as they're bringing it up will increase, so I can't give a solid number today. But I want to emphasize the importance of registering so that you assure that you have your spot. The turnaround time will be within the same day. Total Wellness is able to offer antigen and PCR tests, and we anticipate that those who get tested there will receive their results within the same day.
Do you regret dropping the mask mandate?
No, I think, where we were at that time to give people the opportunity to get fully vaccinated and to continue from there. But it was something I think I made clear at the time too, that we were going to continue to monitor and that we would bring back mandates as necessary to protect our community. They've been extremely, helpful for us and a really important tool. And we're definitely considering all those tools.
And does what Omaha is doing, does that affect what your decision may be?
No, that hasn't affected. If that were the case, we would have a lot of different decisions. I look at our community and what's happening locally. That's why it's so important that we're able to give a local response. And that's what Omaha is doing now. They're looking at the conditions and how to best protect their community. And it's not only is protecting our community, but also working to protect our hospital situation so the people in our community can get the care they need at the time they need it. So what Omaha does, sure, we watch our sister health departments. We pay attention to all that information. But that's why it's so important about local control to make local decisions.
And I guess you just said that we've had the highest amount of infection rate that we've ever had in this entire time. We're in the red. I mean, what else would trigger you taking more action?
That's a good question. And what I said before that we were working on and looking at is what's happening with our healthcare system and what's happening with deaths and what's happening with our cases. So we see our cases going up, and right now we're at a critical step with our hospitalizations. So that's why we're talking with our healthcare professionals to work through some of that and get more data to make a decision here.
Have they asked you for a mandate? Has anybody from the healthcare?
No. Mm-mm. They generally, we work together and we look at all the information available, and our healthcare systems and providers have been extremely supportive of what we're doing in the community, and they have trusted us to use that data to make the best decisions for us going forward. Anything else? All right, thank you for joining us today, and please remember to take action now. Thank you.